a middle-aged person who is working on a computer all day comes to my practice complaining of headaches and neck pain. They have tried everything. Nothing is working. They've been to the optometrist. They've been for physio. They've been to the specialist. They've had x-rays taken, MRIs done, and everything is clear, and nothing that they've tried is helping. They are literally popping pills all day long, every day, and nothing is helping with this headache. They are starting to become unpleasant around friends and family, avoiding social gatherings because they just don't want to be there. They feel terrible all the time with this headache they're having. So this is something that actually happens a lot, and we see a lot of people coming. So they've tried everything, and now they decided, okay, let me try a chiropractor when they come to you.
Welcome to Meet My Business, the podcast where real businesses tell their real stories. Please help me welcome Dominique Brussow, my guest of today. In one sentence, tell me who you are as a person.
I believe I love positivity. So wherever I go, I would like to just spread happiness and I like to see the glass half full, not half empty. And I love helping people. That's a big part of my job, especially because I'm helping people as well. I like to give people solutions, and I like to, wherever I can help, I would like to help.
What does a typical day look like for you?
So for me, in the mornings, I would usually wake up and I would exercise, and then I would go off to work. I would see my patients, and then come back home. And sometimes at night, I do ballroom dancing, so I sometimes go out for ballroom dancing. And then most nights I also have Bible study in church.
How did you end up as a chiropractor? Was this something you planned, or did you fall into it, or was it by accident? How did that happen?
I didn't plan it ever. I always wanted to do something in healthcare, but I never really knew what to do. I did one of those tests, that you do that tells you what you're supposed to be doing. And they said, you can do whatever you want to do. You'll be fine. That wasn't helpful. Parents are very religious, if I can say that. So they always called us together at the end of the day since we were in grade 11. All the children come together in the room at the end of the day, and we would pray together. They said it's important you ask God, what are you going to do one day? And that he should guide you so that you make the right choices. And every single day we would come together, have a coffee, and we'd pray about it. And I was in matric, and I was really, really panicking now because I didn't know what I was going to do the next year. And one day I was with my mom, and she was supposed to drop me at home, but we didn't have time. So she was on her way to the chiropractor that day. So I went along, and I went in with her because I wasn't going to sit in the car and wait. And the chiropractor she immediately saw that I wasn't sure about what I wanted to do the next year. And she was asking me, okay, so what have you considered? And I said, something in the medical line. I don't know, but I'm not sure. I really don't know what I want to do. And she said, have you considered chiropractic? And I'm like, no, I haven't. This is literally my first encounter with a chiropractor. I don't even know really why we are here. So she started explaining to me what it was about, and showing me things and telling me about her story. And I've shadowed a few people at that point, but no one was as passionate about their work as she was. A fire was lit inside me on that day. And it was like, all of a sudden, I just knew this is what I had to do. And I was super sure. I went home, and I was reading up about chiropractic that day. And then I was hoping that I could study it in South Africa, because it would be a very hard sell to my parents if that was not the case. And then UJ actually had a chiropractic course. So I applied to UJ, and you won't believe this, the applications closed the next day. So it was like perfect timing for that. And I got in and I studied chiropractic, and here I am. I've never had any regrets. I never thought, yes, maybe I made the wrong decision in studying this. I love my job. It doesn't feel like work. It's really rewarding work.
Tell me a little bit about the training. How long does it take? Where did you do it? What does it involve?
So I studied at the University of Johannesburg. You can in South Africa study there, and in Durban at DUT. It's only those two places. Then it is a 6-year course. I think now it's 5.5, but it was a 6-year course. You start off with chiropractic. That's the course that you are going for. And you finish, in order to be able to practice, you have to finish with a master's degree in health sciences and chiropractic.
And setting up a practice, what does that take?
Yeah. So I think a lot of people, when they finish, we usually go and locum. So you work for a practitioner, maybe someone, if it's a woman who's on maternity leave and needs someone to stand in, or you work as an associate under someone, because then you get a lot of experience really quickly. You learn how to run the business, or how, the business side of it, because they never teach you that. So you kind of need to know that. And a lot of time people will also, in the industry, you will find a mentor, someone who is already older and looking to retire, and you will work under them and then eventually buy the practice from them. That is, I think, the way that most people do it. But you can also, like what I did, I did locum work here and there, and I opened my own practice from the moment I got a practice number. That's difficult. So it's extremely difficult if you don't know where to start, what to do, if you don't know anything about business. I knew nothing about business. It was, I think, horrible. The first month you see 4 patients. You're sitting there in the office and you're waiting for the phone to ring, and the phone rings and you answer and it's your mom and you're like, get off the line, someone could be calling. So yeah, it's tough. It's tough to begin with. Yeah.
So the business side, obviously a challenge. But then the chiropractic side of it, was that more difficult than you imagined it would be, working with clients? Or
No, not at all. I'm an introverted person, so you might not say so, but I've practiced a lot. I think that was the hardest part for me. Was I was literally afraid of working with people, and then 2 months in, I realized, oh gosh, I chose to work with people, and I don't actually like working with people, or know how to, at least. So that was a learning curve for me. I actually had to learn how to communicate with people effectively. And I think having a good bedside manner is very important, because a lot of people come in there, they're in pain, and they are afraid. You see their worst side because they are in pain. Someone changes completely at that point. And you need to stay calm and collected. You can't also freak out, because then everyone is in a panic. You need to be calm, and you need to be able to put them at ease. And you need to, sometimes making conversation with people just helps distract them from what's going on and helps them relax, and also build trust, because you want your patient to trust you. Someone who is tense and apprehensive, we do manipulations, the rek and pluk. So if they are not relaxed, if they're tense and apprehensive, then it hurts and it doesn't always work. You're not going to get through to those people. So it's very important that you can create a calm and trusting environment for the patient where they can relax and trust you.
Was there a point where you thought, I'm just going to give up, I've had enough?
No. I enjoy a challenge.
Okay.
Yeah.
So what keeps you going?
The thing that keeps me going is that I just know that God gave me this. I believe it. And I know that the work that I've done, even when it gets hard, when you don't get the results that you want as soon as you want them, I always know that I trust the process. I know I'm usually the first stop that you should be making. So there are always things that we can do if my therapy doesn't work. So no, I trust the process. I know I'm doing everything that I can do, and I know that everything is in God's hands.
And if you look now back at your journey, was there something that you wish you had known then that you know now?
Back then, when you just start off, you're kind of scared to ask people who have been in the industry for a long time. We now have in the association, we have a mentoring program where older practitioners who've been through it are actually reaching out to the recent graduates and mentoring them. And I think just going out and asking people who have been in the industry for a while, how are you doing this? How are you coping with this and that? How can I try and do this and improve that? If I had done more of that, I think it would have made it a lot easier, because most of the people are very open to helping and giving you advice whenever you ask them. So,
Okay.
yeah.
And the whole process of building a business, the practice as a business, what surprised you the most?
I had no idea how to run a business, right? I have no idea how to do business. I don't know anything about tax or anything like that. Like, someone would pay me and I wouldn't know what to do with the money. Now what? You think that you're going to open a practice and because it's there, people will come. And eventually they will come, but somehow you need to make yourself visible as well. And I never thought that I would have to market myself. I am usually the person, I don't want to be seen and I don't want to be acknowledged for anything. And now you kind of have to do that. So that was a huge change in my head that I had to make. So I was very uncomfortable with doing it initially. Oh, but I learned how to do it. So it's getting there.
So now imagine there's somebody who's never heard of the word chiropractor. How would you explain to them what it is that you do?
We deal with movement. So any kind of any movement that you have to do in your body, we look at that. Most of our clients are coming to us because they are in pain. Some people will come to you because they are feeling stiff and they feel that they can't move the way they usually moved before. But most people will wait until they have pain and then they will come to you. So what we do, we don't use medications, we don't do surgery or any invasive procedures. Everything is manual therapies. And what we look at is to find where there's a movement pattern that isn't normal and is abnormal, because that is usually causing compensation, which overworks a different part of the body. And because that part gets overworked and tired, then you get pain as well. And that's what happens most of the time. So, for instance, people who have desk jobs, who are sitting for a long day working on a computer in the same position, people always come to me and they say, I have bad posture. So you don't necessarily have bad posture. It's just sitting in the same position for too long is bad, whether your posture is perfect or not. Your body cannot do that. I always say that it's like, imagine you are doing a squat for 8 hours. Your body's going to be sore after that, no matter how fit you are. So it's not necessarily that you're getting pain because your posture is bad. It's because you're in that position for too long. And then you get the other side of the scale where you have people who are very active. They are crawling around in small spaces and they are overexerting their bodies. And then that can also cause you pain. So what we do is we use manual therapies and we address these problems for our patients. It's not invasive, it's not drugs, nothing like that. And a lot of it is education as well. So we're looking at, if you're sitting for too long, how can we help you to take regular breaks? What can you do in your break that will help you? What stretches can you do regularly? We look at your environment as well to see what it is that you're going home to and how can we help you to prevent it from happening again.
What is the difference between a chiropractor and a physiotherapist?
Technically, a physiotherapist is the person who works with rehab, right? You see them in the hospitals after you've had an operation. You've had a surgery for maybe a muscle that you have torn or a ligament, or you had a hip replacement or something like that, or any kind of surgery you need lung physio or that. So it's for rehab mostly. So we're trying to get your muscles to a point where you can move normally and complete your day-to-day tasks normally. With chiropractic, it's a lot more about, so we look at, like I said, we look at movement patterns, but we want to be able to prevent injury from happening. So a lot of times we get people who are athletes and they want to come regularly for treatment because it helps them recover better, and that prevents them from actually injuring themselves, and then they perform better as well. It does overlap a lot, but at the end of the day, chiropractor, like I said, we are doctors, so we can diagnose any condition, but we just treat musculoskeletal conditions. So you are not gonna, with a chiropractor, you're going to come to us and we're going to look at the whole picture. We're not just going to see, okay, you say you have pain in your shoulder and we just look at the shoulder. We try and see where is the pain coming from? Is it actually coming from the shoulder? Is it referring from somewhere else? And we look at your history to try to determine maybe it's something that's some other process in your body that can be causing this. Especially with, like I mentioned, with headaches. There are a lot of things that can cause headaches, and it's not necessarily musculoskeletal. With a desk worker, you can think that maybe it is musculoskeletal because the way you're sitting, your posture before in front of a computer. But other things can also cause it. You can have high pressure inside your brain that's causing it. You can have vascular problems. You can have things like cancers and tumors that can cause it. So, I mean, there is a lot of things. And straining your eyes in front of the computer can cause headaches as well. So there are a lot of things. Dehydration that we look at. We don't just say, okay, we're gonna treat the area because you say that the pain is there. We know that we need to look at other things as well.
People with pain obviously is an ideal client for you,
yes.
But anybody else that you would also like to see on a regular basis?
People who are very active, we like to see them regularly because we can help them recover better and we can prevent injuries from happening. So that's someone that you see on a regular basis. And then we have our office workers and desk workers, people who are sitting for long periods of time. The other thing that's quite a niche for us is pregnant women, because they cannot take medications or anything like that. So they need natural therapies. And a lot of time they struggle with neck pain or back pain, sciatica, those kind of things. And that is something that we can help with in a natural way to give them relief during that time.
What makes you different from other chiropractors?
I try and build relationships with my patients. They're not just a number. It's not just someone who comes in. I do spend time with them. My sessions are longer. I do take a lot of time to get to know the person as well and follow their journey as well. I don't want them to just feel like it's just quickly step in, ruk and pluk, and there you go. There has to be a connection.
What is the most common misconception that people have about what you do?
I'm just going to get a ruk and pluk.
I'll crack my back.
Yes, exactly. So that is definitely one of the main things that we do with most people when they come in is the manipulation. It's a chiropractic manipulation. No one else can do it. But we also do other things. We can do like dry needling, we do cupping, we can do sports massage, we can do taping. There's exercises and stretches that we do with you. So there's actually a lot of things that you can do in a chiropractic session aside from just the ruk and pluk, the manipulations. And we don't do that for everyone as well. So you have contraindications for that. One is, for instance, if they are older, then we're always careful with that because people's bones do get more brittle as you get older. If they have underlying conditions like osteoporosis or things like cancer, that can also affect their bones as well. So you don't just go and rucking on anyone. you don't do that. So we have other ways that we can also help you, gentle mobilizations and things like that can also help you. A lot of people think that when they go to the chiropractor, we're going to break their necks or give them a stroke or break something, but that's not actually that. It doesn't happen quite often. It's like someone published a study and completely took it out of context. And I think a lot of people then just climb on that bandwagon, and then it gives the profession a bad name. But it's safe. It's not, you're not going to get a stroke from it or anything like that. I mean, the chances are really, really slim. So it's a very safe therapy to do.
Let's talk about the benefits now. Somebody comes with pain, obviously, hopefully they leave without pain, or does the pain only go away later? What benefits do people get from your service?
Yeah, so there are quite a few benefits. Depending on what we did in the session, sometimes you might have a little bit of soreness or stiffness for a day or two after we treated you. And depending on how long you also waited before you come to us, long you've been walking around with the pain or that problem, it also determines how long it's going to take for your body to respond to it. So some people might get results within the first session. Some people might need 3 or more sessions before they get results. It depends on how long you waited. With pain and movement, the important thing is that in your body, you have this use it or lose it concept. So if you are not using something, you lose it because your brain has to make space for new information to come in all the time. So, for instance, if you are sore and you're not moving a joint through its full range of motion because it hurts when you're moving it, eventually your brain is going to forget that you have the full range of motion, and you will only feel like you are able to move it in that limited range. And that's going to cause other movement compensation and problems. But a lot of times people will say, yes, they feel like they can move better. They feel loose. I didn't know how stiff I was until I came to you. And then the pain relief as well. That is something a lot of people talk about, and they feel relaxed. And a lot of people report they sleep better afterwards. So that's just some of the benefits, yeah.
So tell me the story of a client that had a really fantastic outcome.
The person that I was telling you about in the beginning when we started with the headaches. So, they had these headaches since they were a child. It has been there constantly. Nothing has helped. And we did one session where we treated the neck and we looked at all the muscle spasms and everything that they were having and complaining about as well. And we scheduled a follow-up for 3 days after, and the patient didn't come for the follow-up. They cancelled their appointment, and 2 weeks later they came back and they said, I want another session. I haven't had a headache for 2 weeks now, but my headache came back yesterday. So we needed another session to do with him, but the pain was gone for the first time. 2 weeks, no headache, no painkillers, nothing. And that was just the start of the journey for them. So then at that point, we are now able to say, okay, you are now without pain. So now you can actually focus on when the pain comes back, what is it that triggered it? Because it doesn't have to constantly be there. It's something in your environment that is triggering it. So now, because there's no pain, you can focus on or see what did I change in my environment that brought on the pain again. Because if it's sore all the time, you can't say everything is going to be sore. But now that you don't have pain, we can actually identify that thing, and then you can be mindful of it and avoid it if you can, so that it doesn't happen again. So this is a brilliant outcome. I mean, it changes the person's life completely. You're going from, I have a headache all the day, I don't want to spend time with people, you become isolated, you can become depressed. And I mean, headaches are awful to have just on a regular day.
What does a client say that tells you that you got it right?
You are amazing. That's basically, much better. I'm feeling much better. It's definitely a huge improvement. I'm doing things that I usually cannot do anymore. They tell you about their adventures that they have, went mountain biking, did this, did that, and it's much better. I noticed this and that's actually a trigger for me. So now I'm not doing it anymore. I changed things in my, they tell you, they immediately tell you what they changed and how it gets better. Yeah.
So just a follow-up question from earlier. People come to you because they have severe pain. Do you think people should come or should have a regular appointment with somebody like you to prevent pain in the first place? Or is it just something I come to you because it's an emergency?
No, absolutely not. You should not be coming to me only because it's an emergency. We recommend that you come at least twice a year for just a checkup to make sure that everything is fine. The reason for that is pain is usually the last symptom to come and the first to go. So you will have stiffness maybe that you don't realize you have or that you are ignoring because it's not painful for you and you can cope with it. And that can then lead to a bigger problem later on. Or you might have other symptoms like numbness. You can notice things like tingling in your fingers or down your leg, or burning sensations, or even weakness. You notice when you have to shake someone's hand, your grip isn't strong, or you're struggling to hold on to a coffee cup or something like that. But it's something that you don't really pay attention to. Only once it gets sore do you then pay attention to it. And a lot of these things that I've just described now are nerve pains, your nerve problems. So again, this is something that it can have a huge effect on you if you wait too long to sort it out. Whereas sometimes it's just a matter of, there's a muscle spasm somewhere and it's compressing a nerve, and we can release that and it gets better, and the damage isn't long term.
How do people get hold of you online?
Online, you can find me on my website. So that's www.brussowhealthcare.co.za. We have online bookings on there as well. So you can just go onto the website and then you can click make an appointment, and then you will be able to make an online booking. Or you can call us or WhatsApp us on 0732001 and we will make an appointment for you.
One last thing for our listener or our viewer here, one piece of advice.
I always say that movement is medicine. So if you are able to move, any movement is good movement. So don't just sit around and not move around or do anything. It's very important to move. If you're moving your body, your brain is getting input. It's very good for you. So don't underestimate how good movement is for you.
In other words, you got to move it.
Yes.
There you go.
There we go.
Dominique, thank you so very much.
You're so welcome.
Very enlightening.
Thank you.
And that is exactly why stories like this need to be told. Thank you so much for being so open about your journey today. If what you heard today resonated with you and you want to find out more about the business we discussed today, every guest we've ever had on Meet My Business, their business name, episode number and direct link lives in one place. Head over to baird.media/Meet My Business.